I'm Mary, Mary Ryan, and I work here in Alder as a consultant in the Children's Emergency Department.
So what does your job involve?
Basically, it's the treatment of anything and everything that could possibly happen to children between the age of 0 days, so the minute they leave the maternity hospital or the minute they're born at home, right up to the age of their 16th birthday. But really it's the care of anything that can happen in children, so even if they get chest illnesses or heart illnesses or infections, but also traumas, so if kids fall and hurt themselves, or they're involved in car crashes, or they get knocked off their bike, all of that kind of stuff.
Sounds very exciting. If possible, I know you could be faced with anything that walks through the door, so you're never really going to know what you're going to wake up to. Yeah. But could you try and sort of describe a typical day in working in the emergency department?
I guess a typical day can be really. I think that the issue is that you start the day thinking this is going to be fine, but you always have to be ready for the unexpected to happen. And that's what I quite like about it. I also really like not knowing what's going to be wrong with the next patient I pick up. So if I was a specialist in chest diseases or infections, you're pretty much guaranteed the person you're seeing in clinic is going to have a chest disease or an infection. With my patients, I have no idea what's going to be wrong with them, and everybody gets put into a queue, prioritised on the level of their illness or the seriousness of their injury. And we see the most serious ones first, and then you work your way down to the less serious ones. And you can have days where all you see are children who are not seriously unwell, not very injured, but have something small wrong with them. And you can have days where you never get to see those patients because you're busy with really sick and injured patients all day. We're a major trauma centre here, so we have children helicoptered in from the whole region, right up to the top of the Lake District and across to North Wales and the Isle of Man. So if you have an accident and you're severely injured, you don't stop at your local hospital anymore. You're put in a helicopter and you're brought here straight away. So that can be really challenging. And last night I worked, and we were having a lovely night. There was about 12 patients here, and we were kind of strolling around thinking about having a cup of coffee, and within an hour there was 2 helicopters in and the whole place had changed. So it's really exciting and challenging from that point of view.
To me, that sounds a little bit scary. Do you feel like through training, you're prepared for sort of anything that can come through?
Yeah, absolutely. I think if you spent the whole time at work being scared of what was coming, then you'd be in serious trouble. So there are scary bits, and even now there are still some things that come in that make you just take a breath and think, wow, okay. But your training kicks in, and there's a common process, and I guess that's where things like resuscitation courses and stuff are really helpful. It doesn't just teach you how to resuscitate, but you're talking the same language as everybody in the room. So everybody's done the same course, everybody knows how we're going to approach things. And the course has changed. The course I learned 20 years ago is not the one we use now, and that's fine. You have to stay updated and you have to stay fresh. But your training kicks in, absolutely, and you just try to focus on each part of the child as you're going through the whole system, and not be overwhelmed by everything that's happening in the room.
Is there particularly anything that's the most challenging?
I would say probably the parents are the most challenging bit, because we deal with kids who come with families. So we very rarely see a child who comes on their own. We do occasionally, but most of the time children arrive with, not just parents, but sometimes brothers and sisters and grandparents and aunties and uncles. And actually often it's the parents that are much more anxious than the child. So you've got to treat the whole family, not just your one patient.
What else do you particularly enjoy about the job?
I really enjoy not doing ward rounds, and I really enjoy not doing clinics, and I really enjoy not doing a lot of paperwork. So I guess when you're training in paediatrics, because I trained in paediatrics and then did peds emergency, you can do emergency and then do paediatric emergency, but I did paediatrics first, and I did a whole range of stuff, caring for babies in neonatal intensive care units, caring for children out in the community, caring for children with disabilities, tons of stuff. And you get to learn pretty quickly what are the bits of the job you like and the bits you don't like. And the bits I really don't like are kind of the boring bits where you just do routine reviews and you see children and sometimes they have something wrong, most of the time they don't. Generally children get better when they're in hospital, which is really nice. So I much prefer to have the unpredictability and the short, sharp kind of consultation. So they're the bits I don't like. And I guess, to be honest with you, sometimes I don't really like the late hours and the nights. Because when I was young, when I was your age, that was fine. And when I was starting out, that was absolutely fine. And your body can handle it. But sometimes as you get older, that's maybe a little bit more difficult. And you've got family stuff at home and it's not really great to be getting up at 2 or 3 in the morning. But the job changes as you get older and you do different things, and sometimes you can move away from doing nights if you want to.
How have you found, I don't know if you've ever worked with adults, but how have you found this working with children particularly challenging? Or?
Yeah, I did in my early days. I did some work with adults. I think some people find it incredibly challenging. I personally much prefer it, which is probably a good thing, as I chose to do paediatrics. A lot of our kids can't really talk to us, so you do become a little bit like a vet. You do have to look at them from the bottom of the bed and just go, okay, are you sick? Are you not? And there's some tests that help. But when your patient can't talk to you, you have to really rely on your clinical judgment and just knowing what children should be doing and then worrying about it when they're not doing that.
Okay. How do you find you've coped sort of outside of work, or what did you do to sort of to cope with when sometimes the day isn't great or sometimes the job gets a bit too stressful?
Yeah, I mean, I think that's a real issue. And people say, especially with children, I think any branch of medicine really, unless you get into pathology or something where everyone's going to be gone anyway. I think you can have really, really hard days. I think your colleagues support you a lot, and if you're part of a good team, that's really, really, really important. I think if you find yourself working in a situation where the team dynamic doesn't work for you and you don't feel supported, then you should really look again, because you have to have a team around you in emergency work, and you have to have people to rely on. I think you have to be careful with yourself, make sure you get rest, make sure you take exercise, make sure you eat well, and all that stuff that we tell everyone to do and then don't do ourselves for a large part of our lives. But if you do those things, you definitely feel stronger. And I think just taking care of your life outside of work, it is a tough job, and you have to make sure that what you've got on the outside is really, really solid, and you have to invest time in the outside as well. It's just as important to pay attention to your relationships at home and your family and looking after yourself as it is to come into work and do a really good job for the strangers you meet here.
Is there anything that you do activities-wise or hobbies that you've got outside?
So I've just signed up for a 100k bike ride,
wow.
Which is happening in 5 weeks' time. Signed up a few months ago, done very little training, so now the training starts in earnest. So I rode 50k last Sunday, 2 days ago. Still feeling it a little bit, but getting into that now, which is really nice. I'm riding for the Alder charity through the night. Through Liverpool, so I think it'll be good fun, and it's really good to have something to aim for, because otherwise it's just very easy to sit in the sofa and watch movies.
Is there anything you do work related but outside of your duties in the emergency department?
So I'm a trustee of the Advanced Life Support Group in Liverpool, here in Liverpool, and that's a separate charity that provides all the resource courses for kids around the region. So basically we provide the APLS course, the Advanced Paediatric Life Support course, and we train lots and lots of people, probably about 300 or 400 people a year through those courses. And that's really rewarding. We make a tiny profit each year, which we reinvest in the charity. And for a couple of years, we had a really good partnership with the Children's Hospital in Kathmandu, in Nepal. So I've been there 3 times working with them and helping them set up resource training in Kathmandu. So that was really exciting, and not something I would have ever done without this job.
There a student who wants to apply, and particularly maybe want to do paediatrics, not sure if they want to do sort of emergency department yet, is there any sort of skills that you'd say that they not necessarily need but might like to have, and sort of think they would be better suited to do, so working with children and then also doing emergency medicine?
Yeah, I mean, I think fundamentally you kind of have to like children. I know that sounds kind of ridiculous, but some people just don't have a really good affinity with kids and don't really know how to speak to them. It's not hard to get used to it, but if you find that, we find sometimes people have younger brothers and sisters or nieces and nephews and things. I think you have to be really flexible with paediatrics. You can't want to examine a patient there and then and expect them to be ready for that to happen, or to be flexible to your needs. You have to be flexible to their needs. So if your patient's asleep, it's probably not a good idea to wake them up, mainly because they'll be grumpy, but also because actually children need sleep to recover. So you definitely have to be able to be flexible and to work around your patients. Sometimes our patients just won't be examined, they just scream hysterically and you can't get close to them at all. So you have to be able to watch them playing, even from 10 metres away, and get loads of information from that. So you get taught a lot of that when you do paediatrics, and you watch people who've done it for a long time behave in certain ways, which is really helpful. But I think of many of the specialties, you have to be ready to work around your patients rather than the other way around.
The sort of career pathway that you'd have to do, so for example, the students apply, they've got into medicine, so they've done their 5 years training. What would the next step be to get into sort of the field that you do? So
obviously you do your foundation years. It's really great if you can get a bit of paediatrics in that foundation rotation. Not everyone gets to do it, and you don't have to apply for paediatrics, but it would be really good to do a bit so that you can decide if you like it or not. Bearing in mind that when you do your early years, you often have to do a lot of sort of very routine work on the wards and stuff. It's not really responding to emergencies for quite a while in paediatrics, because we have to make sure that everyone is really able for it. So it's slightly different to adult work in that way, where you're more thrown in at the deep end. So when you do your foundation years, if you then want to apply for paediatrics, you apply to the run-through training scheme for peds, and you can become a general paediatrician really quite quickly. Within 5 years you can be a fully fledged general paediatrician and apply for jobs in district general hospitals in general paediatrics. If you want to specialise in an aspect of paediatrics, like emergency or intensive care or respiratory or gastroenterology, then all of those are available just like in adults, but you will have to do 2 more years training.
Is there any sort of advice you could give to any of the students who want to do just medicine in general, or if they're interested in doing paediatrics, any sort of advice you can give them?
I think from looking back at my medical school days, and maybe even the first few years when you're trying to get your postgrad exams, and it's a bit of a slog, you just keep at it, keep goal focused, keep the end of the road in your mind, and keep at it. There are boring bits, there are bits that you won't enjoy as much. Part of the job of medical school is to give you a flavour of everything, so that you can be a little bit more focused when you do graduate, and you can say, well, I definitely don't want to be a physician, or I definitely don't want to be a surgeon, or I really want to be a GP. Every single job in medicine has its ups and downs, but you know what? Every job in banking and law and Tesco has its ups and downs, and you have good and bad days. But overall, I wouldn't change it for anything. I think it was the best decision I ever made, and it's given me opportunities I wouldn't have had elsewhere.
Brilliant. That's fine. Thank you very much.